Hey folks, I'm Dr. Olson with Sports Medicine Orthopedic Centers, and I'm continuing this ongoing Q&A discussion regarding the use of PRP. So next question that I'd like to address has to do with PRP versus cortisone. Those are two very common injections that we use in our practice. And so I thought I'd shed a little light as far as questions that you may have when it's appropriate to use cortisone or whether it's appropriate to use PRP. Can they be mixed together? What are the differences between them? So we'll first start with cortisone. So cortisone has been around for decades and it's used for orthopedic applications. In most instances, it's covered by insurance and it has widespread use in the office for orthopedic surgeons. There's been a lot of studies that have been done on cortisone, and I do think there are some important takeaway points from the use of cortisone. First and foremost, cortisone is not regenerative. Cortisone represents an anti-inflammatory agent, a very strong anti-inflammatory agent. And it works by injecting into a joint or around a tendon to diminish the immune response. So the goal of cortisone is to inhibit the immune response and to take down inflammation. So PRP be considered a regenerative technology. The use of PRP is still evolving. The use of PRP is not covered by insurance typically. And the use of PRP is very different from that of cortisone. Whereas cortisone seeks to suppress the immune system or suppress inflammation, the use of platelet-rich plasma serves to facilitate a very aggressive tissue response in the body, whether it's applied to a tendon or whether it's applied to a joint. So there's a lot of debate and a lot of questions regarding the use of cortisone versus PRP. They're very different concepts. Some of the questions that we get regarding the use of cortisone versus PRP is, when is it best to use cortisone? When is it best to consider a PRP injection? Which one is going to last longer? Are there any risks with use of either one? So I'll try to answer a few of those questions. First off, use of cortisone in most instances would be considered a temporizing measure. It's usually not a permanent or a long-term fix. Use of cortisone, as I said before, is also covered by insurance. The use of cortisone has a very reasonable safety profile. I do think there are some concerns regarding the use of cortisone. In diabetics, for example, it can cause a transient elevation in blood sugars. Another concern regarding cortisone is that its repeated usage can often cause the breakdown of tissue, whether that relates to cartilage in a knee or another joint in the body, or whether it represents a tendon. There is some risk of tendon rupture, and there also can be some atrophy or some loss of soft tissue if cortisone is repeatedly done. So it certainly is not risk-free. PRP, on the example, does have an excellent safety profile. PRP has very few risks associated with it. After all, it is your own body. You're taking a sample of blood, you're concentrating it, you're isolating the platelets, and then you're injecting it into a damaged tissue. PRP is not typically covered by insurance. I think there's been a lot of variability in how long PRP lasts. I think that our hope is that the use of PRP will provide a more sustainable solution, but there's still a lot of variability in the literature regarding its usage, and we're still evolving the technique. That includes, how do we concentrate the sample? What is it in a sample of PRP that makes it important? We seem to know that the more platelets you have up to a certain threshold seems to be better. So there's still a lot of unanswered questions, and I think that over time, we'll learn a lot more about when it's most appropriate to use PRP. So another question I get is, can we use PRP along with cortisone? And I think the resounding answer to that is no. And I think if you think about it from the way in which each of these substances work, you'll have a better understanding why the use of the two together would not be productive. Cortisone, for example, is an anti-inflammatory agent. It seeks to decrease inflammation. So it has an impact on the immune response. It diminishes it. Whereas the use of PRP serves to generate a very aggressive tissue reaction. So using cortisone in the presence of PRP would be counterintuitive because you actually would be injecting two substances that essentially perform very, very different actions, in many ways opposite. So, for example, in our clinic, if we have a patient that's had a cortisone injection, we will insist that they wait a minimum of 90 days before they consider any type of regenerative medicine, including PRP. So one of the questions I get is, can you use PRP and cortisone together? And I think the overwhelming answer to that question is no. And the reason for that is the two work very differently from each other. And to use the two of them together would be counterproductive. In many respects, they have opposite effects on the body. Whereas cortisone seeks to suppress an inflammatory response, decrease inflammation, decrease the immune response, PRP serves to facilitate a very aggressive tissue reaction in the body. So you wouldn't want to use cortisone when you're trying to apply a PRP injection, because if you're trying to generate a very aggressive tissue response, you don't want anything present in that area that's going to suppress that response. So for example, in our patients that have undergone a cortisone injection recently, we make them wait a minimum of 90 days for that substance to clear before we'll consider any type of regenerative technology. So I do think that's an important concept to take away, is although they both have different mechanisms of action, the use of them together would be counterproductive.